In this video I want to talk about muscles of the head and neck. Now muscles of the head are basically divided into muscles of facial expression and muscles of mastication. Facial expression is fairly self-explanatory. Muscles with which we make different facial expressions. Muscles of mastication are muscles that we use for chewing. First I want to talk about the muscles of facial expression, and then we'll move into muscles of mastication. The first muscle of facial expression that I want to talk about is known as the occipitofrontalis. Now some books also call it the epicranius. The occipitofrontalis is made up of a frontal belly, sometimes known as the frontalis muscle, and an occipital belly, sometimes known as the occipitalis muscle. They are actually connected by a sheet of connective tissue known as the gala aponeurotica. So they are technically considered one continuous muscle, connected by the sheet of connective tissue. So you can see why it may be known as the frontalis, the occipitalis, or the occipitofrontalis in total. Now if we move around to the face itself, we see a muscle which has circular fibers which go around and around the opening of the orbit of the eye. This muscle is known as the orbicularis oculi muscle. Orbicularis oculi, circling the ocular area. Now I'm going to dive down around the oral cavity for just a second. Circling the oral cavity, we have another circular muscle known as the orbicularis oris muscle. The orbicularis oris muscle. Now one of the things you need to remember about muscles of facial expression is many of them do not have two bony attachments. Some of them attach to bone, and then the other end of the muscle attaches into the connective tissue of the skin. Some of them do go from bone to bone. Some do not have any bony attachments, but rather go from connective tissue near one muscle to connective tissue near another muscle. So it's a good landmark to have our orbicularis oculi and our orbicularis oris muscles. Both of these act pretty much like sphincters. They will purse string the structures closed. So orbicularis oris purse strings the mouth closed. Does not elevate the mandible, but it closes the lips. Orbicularis oculi closes the eyelids. Now if we look very carefully between the orbicularis oculi and the orbicularis oris, we see a muscle that looks as though it's coming right out of the bottom of orbicularis oculi and going into orbicularis oris. This muscle is known as the levator labii superioris. As its name implies, it lifts the upper lip. Levator labii superioris. Immediately medial to that muscle, we have a long, narrow muscle, the longest named muscle in the body, the levator labii superioris alicae nasi muscle. Ala means wing. Nasi refers to nose. It runs along the wing of our nose, the edge of the nostril, to help lift the upper lip. Hence the name levator labii superioris alicae nasi muscle. Out on the nose itself, running from a medial to lateral direction, we can see a small muscle known as the nasalis muscle. Just lateral to the levator labii superioris muscle, we see two other muscles with a gap between them. Both of them come off of the zygomatic process, zygomatic bone, and one heads down toward the orbicularis oris, and it is the smaller of the two. It is known as the zygomaticus minor muscle. Zygomaticus minor. It helps to lift the edge of the lip, as in smiling. Then there should be a small gap, and then another muscle. This model almost depicts it as two muscles, but it is one muscle. It is the zygomaticus major muscle, coming from the zygomatic bone down to the very corner or the angle of the mouth. Zygomaticus major also helps to lift the corner of the mouth, as in smiling. If we look in the gap between the zygomaticus minor and zygomaticus major and deep, we will see another muscle known as the levator anguli oris muscle. Levator anguli oris, as its name implies, elevates the very angle or the corner of the mouth, so definitely used in smiling. If I rotate this head to the opposite side, where they have removed most of the muscles of facial expression, here we can see the levator anguli oris coming down from part of the maxillary bone into the angle of the mouth. So levator angulioris here on this side, found in the gap between the two zygomatic muscles, zygomaticus major and minor, on this side. Heading straight back from the corner of the mouth into the mandible is a muscle known as the rhizorius. The rhizorius will pull the corners of our mouth straight back. Now if we look deep to the rhizorius and much wider than the rhizorius, from here down to here, we see the muscle that forms the bulk of our cheek, or the lateral walls of our oral cavity. This is known as the buccinator muscle. The buccinator muscle. If I rotate the head so that you can see the left side, here we've removed most of the muscles of facial expression again, and we can see very clearly the buccinator muscle. The buccinator muscle is considered to be both a muscle of facial expression and a muscle of mastication. If you're learning the nerve supply to these muscles, buccinator is innervated as if it were a muscle of facial expression, innervated by cranial nerve 7, the facial nerve. Going back around to the other side, right side of this head, we see three muscles which are inferior to the plane set by the rhizorius and the oral cavity. One muscle comes out of the mandible and heads into the skin of your chin. This muscle, which has been cut off on this model, is known as the mentalis muscle. The mentalis muscle. Immediately lateral to the mentalis muscle, we have a muscle which comes from the mandible up into the lower lip, so that contraction of those fibers will pull the lower lip down. This is the depressor labii inferioris. Its name tells you it depresses the lower lip, or pulls the lower lip down. Immediately lateral to that, we have a muscle that comes to the angle of the mouth from below. This is the depressor angulioris. It pulls down the angle of the mouth. The depressor angulioris. Those are the muscles of facial expression that we can see on this model. Now I'd like to talk briefly about muscles of mastication. We already mentioned that buccinator is sometimes referred to as a muscle of mastication. There are two other muscles of mastication that we can see on this model. There are two others that are not depicted on the model. One is known as the masseter muscle. The masseter comes from the temporozygomatic arch and inserts along the ramus and angle of the mandible. It is a very short but very thick muscle, slightly lower and anterior to the ear, the masseter muscle. It functions to elevate the mandible or close the jaw. If we rotate this model to the other side, we can see one of the other major muscles of mastication. This muscle is known as the temporalis muscle. The temporalis muscle is a very large muscle coming from the side of the head, a little bit from occipital bone, parietal bone, frontal bone, even sphenoid bone, and is a convergent muscle that will pass below the temporozygomatic arch to insert on the coronoid process of the mandible. It acts as a very powerful elevator of the mandible. So again, we use this muscle for mastication, for biting. Very strong elevator of the mandible. Muscles of mastication are innervated by the trigeminal nerve, cranial nerve number 5. Now before I leave these muscles, I want to point out, here is temporalis muscle on this left side of the skull. If I rotate to the right, we see something that looks like it's pretty much in the same position as the temporalis muscle. However, this is more superficial than the temporalis muscle. This is the auricularis muscle. The auricularis muscle. Do not confuse auricularis with the much larger and more deep temporalis muscle. So we have now done muscles of facial expression, mostly on the right side of this model, and muscles of mastication. The masseter on the right side of the model and the temporalis on the left side of the model.